So tonight we are here with Dr. James Lally. He is running for Congressional District 3 here in Las Vegas. He is challenging incumbent Susie Lee. Thank you for joining me tonight, Dr. Lally. How are you doing?
Good. Thanks so much for having me tonight, Joe.
Great. So, Dr. Lally, you're a grassroots candidate, so your constituents are very important to you. Transparency builds trust. How will you how you ensure full transparency in who you're taking donations from, how you're making your decisions? That way your constituents know who has access to you.
Yeah, I think that's a real important question. I would say the first thing definitely is no corporate PAC money and no APAC money. If you're taking money from corporations or far-right groups like APAC, constituents are unsure where you're actually leaning towards. Are you working for them or are you working for someone else? I think in medicine, we saw this, it was a little bit before my time, like 25 years ago or so. Drug companies, they used to fly doctors on plane trips all around the world, buy them expensive gifts. And American people were saying, hey, what's going on here? Are the doctors, are they responsive to the patients or these drug companies? Americans got fed up. Congress passed laws against it. Now that doesn't happen anymore. We see the same thing happening in politics now, where so much money is in politics from corporate America that it can really distort things, and it makes the voters wonder, who are the politicians working for? Are they working for the people or are they working for corporate America?
Mm-hmm. Yeah. So one of the big issues right now is our Democratic leadership in Washington. If the Democrats retake the House and you're part of that freshman class coming in there, would you support Hakeem Jeffries staying as majority leader, or do you believe that this caucus needs new leadership?
I think with a question like that, I would want to first make a difference between him and Chuck Schumer. I think Chuck Schumer in the Senate needs to go. We recently had this standoff over the Affordable Care Act subsidies. Chuck Schumer caved on this. They didn't get the subsidies passed, and he was not able to hold his caucus together. At the same time, Hakeem Jeffries was able to hold his caucus together, and he held them together to stand up for the Affordable Care subsidies. That being said, though, I think that a lot of people do want to see more fight from Hakeem Jeffries. They want to see him a little more attack Trump and MAGA a little bit more. We haven't seen that. And they also want to see him, he's got to get away from the AIPAC money too. He's taking a lot of money from far-right Israeli causes such as AIPAC. So I think we'll have to see how things go with Hakeem Jeffries. One thing I would say, though, is that I think that he has done a good job of trying to get along with everyone. I think sometimes people say, we want to see someone in that leadership position with more fight. But sometimes if you're bringing more fight, you may be fighting your own party as well. And in that leadership position, you need someone who can get along with everyone. That's important too. So I think as far as Hakeem Jeffries, it's a wait and see thing.
Okay. And speaking about money in politics, a lot of talk in the past years about the amount of stocks that are being traded by members. Would you support a full ban on stock trading by members of Congress and their spouses?
I think as far as an individual stock ban, absolutely. There can't be single trading of stocks. We saw this with our current representative in Congress, Susie Lee. She was trading in German arms manufacturer, Rheingold AG. No one had ever heard of this stock. No Congress people had ever traded it before. She was trading the stock under her children's name. Stuff like this needs to go. I think what would be appropriate, more along the lines of some kind of blind trust where politicians could have someone monitor the account, trade in index funds of the Dow or the NASDAQ, something like that. But no, definitely no single trading of stocks.
Okay. Being in medicine, in the medical profession, you criticize profits before patients. Do you support Medicare for all, a public option, or like a hybrid model? What's your ideas on those?
I think as far as the healthcare system, what we need going forward is whatever we can get through Congress. What I hear from patients is, and pretty much everyone, is the same thing on the left and right. It's an issue. We're hearing the same complaints. People on red states and blue states, they all say the same thing. They're saying, we're paying too much for healthcare. We need to get everyone covered. No one should go bankrupt just because they get sick. And people are sick and tired of seeing GoFundMes when someone goes to the hospital. This kind of stuff needs to stop. So I think it's an issue where there's a lot of stuff where I think we need to stand up to the Republicans and MAGA. Healthcare is one. I think we should work with them. As far as what's going on with the healthcare system, I think most of the problem is with, and what I see is there's been a corporate takeover of American medicine. So we see it. Most people complain about the for-profit health insurance companies. They're taking money out of people's pockets. But we see the same thing for-profit hospitals as well. They're taking just as much money out of people's pockets as the for-profit health insurance. Drug companies too. And I think what a lot of people don't realize is that healthcare providers, physicians, nurse practitioners, and so forth, most of us, and it goes up every year, are being employees of for-profit health insurances, for-profit hospitals, private equity, things like that. When the physicians are controlled by that, they're part of corporate America as well. And in corporate America, they're not as concerned about the patients. They're more concerned about their shareholders. So what we need to do going forward is, whether it's Medicare for all, some kind of public option or hybrid choice, something where, whatever it is, we need to get corporate America out of healthcare as much as it is. They're just too involved in healthcare, and that's really why things cost so much in America today.
Okay, so would you empower Medicaid to negotiate with the in-cap prescription prices? Do you feel that's a worthwhile cause to go after?
I think absolutely, and we've seen some success with that so far. The Biden administration's been pushing that, and Trump has been pushing that as well. I think that we do need to support when drug companies, they come up with blockbuster drugs that can really help save lives and really can help patients. One example of this is GLP-1 agonists. We see this in cardiology. These drugs, they benefit heart patients. They help save lives. They also help with weight loss. They help lower blood sugar as well. I think, though, that the cost of developing these sometimes is passed on too much to American patients. We'll see a drug that'll cost $300 in America, and then in Canada it's $75. This makes no sense. We can't have something like this where everyone's like, hey, if you need a drug at a reasonable cost, you have to go to Canada. If Canada's putting something at a certain price, or other countries are as well, American patients should pay about the same as that. We can't be subsidizing the healthcare of patients in other countries, and it seems like there's a lot of that going on right now. So I definitely think Medicare needs to be empowered to lower the cost of drugs.
Okay. Let's move on to housing, because housing costs are crushing families here in Southern Nevada. Do you support federal rent stabilization or a stronger national tenant protection?
I think it's something we could do both of that. There's no federal rent stabilization now. There have been efforts in Nevada to pass something like that. There was recently, I think it was in 2023, a bill that was attempted to get through the legislature. It would cap rent increases at 5% a year in patients who were older than 62. It got through the assembly, but Lombardo vetoed it. Something like that in Nevada would be good, but on a national level as well, no large increases in rent. There have been some efforts, I think, it's not gotten through Congress yet, but some efforts to have like a national tenants bill of rights where people will be entitled to safe housing, safe and secure housing, no unfair rent increases, and no unfair evictions as well. We definitely need protections like that. I think we saw an example of that recently. I don't know if you heard about the Hebron apartments down near the middle of town.
I did see something about that.
They're apartment buildings for people low income, and the nonprofit that was running them lost their status to run them, so the apartments were bought out by a for-profit owner, and now they're doubling the rent. They're evicting people on a moment's notice. These people have nowhere to go. That's the kind of stuff that needs to stop.
Yeah, people are scrambling over there. Do you support a federal minimum wage of $17+ an hour?
I think that's definitely reasonable. They've done this in California with fast food. They said fast food workers in California, $20 minimum wage. There was concerns that this is going to put franchises out of business, but it really didn't happen. So I think definitely people need to be paid a living wage, something you can live off of with their wages like that.
And what about a tipping minimum wage?
Tipping, we actually have a pretty good system here in Nevada. Nevada, the minimum wage is $12, and it's the same for tip people as well, which is good. So you still get the $12 and tips on top of that. There's other states where the tip minimum wage is as low as $2.15. So that's something that definitely should be raised on a federal level. And the minimum wage is still $7.25 nationally. That's something that absolutely has to be raised. That is far too low to live on.
Definitely. One of the big issues right now is immigration, of course. On immigration reform, what specific enforcement measures would you like to pair with a pathway to legal status?
I think definitely, even the Republicans now are saying this mass deportation campaign has not worked, and Americans are frustrated and sick and tired of ICE. They don't want ICE terrorizing people on our streets anymore. This needs to stop. I think there's some things that we can agree with Republicans on. I think we do need control of the border. Trump has this idea of a border wall. I don't think that that's the most rational thing to do. I think we need control of the border, but a wall seems kind of outdated. We need more advanced measures, whether it be high-tech cameras, drones that can work. There's some kind of 21st century border control, and also a border protection system. Enough people there to man the border. As far as other changes, I agree with them that if someone's a undocumented felon, they should be deported.
Yeah.
Other people, though, should be more protected. We need people, immigrants, we need people from outside the country to help the workforce. That does help our economy. In the fields, we have people that are working on temporary visas. They need to be protected. J1 people who are working in healthcare, that needs to be protected as well. We also need a system where people can get a pathway to citizenship as well, specifically DACA recipients and temporary protected status. There's a recent bill that was trying to bring up in Congress called the Dignity Bill. This is something that our current representative Susie Lee had sponsored this, but Republicans were insistent on this, that there could not be a path to citizenship for DACA recipients and for temporary protected status as well. That includes people that fought for the U.S. Army, the U.S. military in Afghanistan, came to the U.S. to be protected, and now they're being told that they have to leave. These are people that they fought for us there. They should be given citizenship. For some reason, the Republicans, they do not want to give DACA or temporary protected status people citizenship. I think it's something we should hold our ground on this.
So we are over 3 weeks in an unauthorized military action in Iran. Would you vote against an unauthorized military action as such without explicit congressional approval?
No, I think definitely going forward, especially with the Trump administration, we need approval of Congress. I agree with a couple weeks ago, Ro Khanna and Thomas Massie tried to get the War Powers Resolution passed through Congress. This is a no-brainer. This is something definitely should have been passed, and we should really have congressional approval before a large-scale war such as Iran.
So your opponent, Susie Lee, she's been in office for a while now and representing Nevada District 3. What vote do you believe that she's taken recently or throughout her career that's harmed working families in District 3? And what would you have done differently?
The one that sticks out the most would be her vote on the Lake and Riley Act. This is the act. This has enabled ICE and allowed people to be deported without due process. What I heard a lot from the communities, specifically in the Hispanic community, it kept people from going to work. People were afraid if they went to work, they might be picked up by ICE. I heard stories of they would have farmers markets in the area, usually on the weekends. This stopped when ICE started picking up. People were afraid if they went there, they would be picked up. So this really hurt the economy in certain areas of the city. That's a vote that I think definitely I would have voted the other way on that for multiple reasons. There's another vote coming up soon. They tried to pass last year. They may try to pass again. It's called the Stop Terrorist Fund, which is a really bad name for it. It's really a nonprofit killer.
Okay.
So what this does is this will give the government the power to say, like, any nonprofits, oh, these are terrorist organizations, we're going to shut them down. That really would put a lot of people out of work. It would stop a lot of nonprofits. This is just giving the government way too much power to decide how nonprofits can work. And it would specifically target, I think, organizations that would be pro-Palestinian or supportive of far-right Israeli causes. So that's one that really should not pass. It hasn't been passed yet, but it's something I definitely would vote against that if it were to come up.
Okay. So in conclusion, the one last question here. I'm a brand new Nevada District 3 voter. I'm just meeting you for the first time. I know very little about you. I know very little about Susie Lee. What do you want to tell me that's going to make me want to get to the polls and vote for you, and even more, get out, door knock, phone bank, and really join your grassroots movement?
I feel like voters from all over the political spectrum feel that we need change, that this economy is not working for us, and we need to make changes in the economy to build an economy that works for everyone, make this cost of living crisis, make things more affordable here. We need to fight back for that. We need to fight against corporate America. And I'm also going to take the fight on other issues as well, as far as standing up against the genocide in Gaza, standing up against ICE, and standing up against Trump and MAGA, which I feel like there's too many Dems in Congress that aren't doing enough of this. So I would say it's simply like, I will go out there, I will fight for you.
Great. All right, that's Dr. James Lally. Remember, here in Nevada, our primary is on June 9th. Early voting starts May 23rd, I believe. Is that correct, do you think?
2 weeks before.
Yeah, 2 weeks before. So it'll be around the 23rd. If you want to learn more about Dr. Lally, his website is linked in my link tree. Please go ahead and check it out. And Dr. Lally, thank you so much.
Thanks a lot, Joe. Thanks for having me today. And that website, lallyfornv.com.